Hello, welcome to Get Hooked on Wellness TV show. My name is Edward Hooks and I will be hosting today. Our message for this segment is going to be on healthcare literacy. And we feel like people really need to know more on this topic. And I also think a lot of people can relate to it. Going to the doctor, trying to explain what is wrong, trying to understand what was said, and then leaving with a plan that actually works and makes sense. For this conversation, and it is for educational purposes only, it's not personal medical advice. We are not here to advertise or to promote a product or tell anyone what treatment they should choose. We want to help patients and providers understand each other better. You spent more than 21 years in family medicine and in primary care. Today, I want to speak to you or you speak to me from the provider's point of view, and I wanted to speak to you from the patient's point of view.
Well, hello everyone. My name is Dr. Alexandria Hooks. I'm the owner of Hooked on Wellness Clinic, and I am glad we are talking about this because most people want the same thing. Patients want to feel heard, respected, and helped, and providers want to give safe, accurate, and compassionate care. But the healthcare system can create pressure on both sides.
And that's something that's very important. This is really at the heart of the conversation. Patients often feel rushed or dismissed, and providers are often working under very tight appointment windows. They have a lot of documentation, there's a lot of requirements, there's phone calls, even lab follow ups, and the insurance demands a lot from them. So today, we want to bridge that gap.
Exactly. And I'm glad you mentioned that. We did a previous segment about traditional primary care clinics and direct primary care clinics. I own a direct primary care clinic, so I'll help you better understand the differences between those two as we go throughout the subject. It's best for patients to come prepared with the information, and providers can communicate in ways that are clear, respectful, and realistic. And before we go any further, I want to say in direct primary care, the patient has a lot more time during their visits compared to traditional medicine clinics. In traditional medicine clinics, it's about quantity versus quality. You're seen in 15 minutes, you're in and out. But in direct primary care, your visits are much longer, you get more time with the provider. They're a minimum of an hour, sometimes even longer.
Thank you for taking the time to answer all of my questions. It made me feel heard, and I understand my health so much better now.
And the information that we're bringing, we also will help you to maybe navigate your regular doctor right now. So the information we bring to you is very, very useful. So our goal is not to blame patients and it's not to blame providers. Our goal is to help people walk into an appointment with purpose, information, and a plan. And to help clinics remember that every person who walks in is more than a chart, a copay, or a time slot.
Before we get started, I do want to mention one more thing. I want to read some highlights from an article I wrote to help patients prepare for their doctor's appointment to improve health literacy. And it's entitled, Be an A-plus Patient, Simple Health Literacy Habits That Make Every Visit Better. And basically, it's just something I put together to help patients learn how to better be prepared. The Center for Disease Control actually notate that health literacy is the degree to which individuals have the capacity to obtain, process, and understand basic health information and services to make appropriate health decisions. I like to tell my patients, bring a folder with you, get a copy of your progress note, bring your list of medications, write a list of questions that you have before the appointment, get the business card of every doctor you see, Take your folder with you to all your doctor's appointments. These are the kind of things that help navigate the healthcare system and make it a lot easier for you.
And we will be going over these same things again. But right now, let me start from the patient side. Okay, so a patient may wait weeks for an appointment, sit in the waiting room, fill out forms, get roomed, and then feel like the provider is in and out in just a few minutes. Why does that happen?
Well, like I said before, um, when you are in a traditional primary care clinic, that's usually how it is. In direct primary care, it's very different. But there are several reasons why that can happen in traditional medicine. A provider may have a very tight schedule. In one visit, we may need to review a chart, confirm medications, address symptoms, screen for safety, update preventative care, order labs, handle refills, document everything in the electronic medical record, and explain the plan. That's a lot to do in a short amount of time. And that's taking into consideration that the patient came on time and there wasn't a holdup at the front desk checking them in, and the staff was diligent and um, h- process the patient quickly enough to get them back to the provider, leaving the provider an appropriate amount of time to work with the patient. So that's why people feel rushed. The feeling is real, and the challenge is in that system. Oftentimes, the patient expects a human conversation to fit into a very limited time block, and it's just not realistic. And patients don't understand what goes on behind the scenes.
And that really helps us to understand what it means from the provider side. When someone is worried, in pain, confused, or afraid, 5 or 10 minutes can feel like nothing. And if the provider is, typing the whole time, it can feel like the computer is getting most of the attention. But as you can see and hear, that there is a lot that's going on. Sometimes a person may feel that you're giving their computer more attention and not really paying attention to them.
That's a fair point. And the electronic health record is necessary, though, but it can be a barrier if the provider doesn't manage it well. So, one practical solution is to tell the patient up front what you're doing. For example, I'm going to type this so I don't miss one word that you say. Everything you say is important to me, and I want to capture that and put that into the record. Let me look at you first, and then I will update the chart. Small statements like that can protect the relationship.
Absolutely. One of the common complaints that we're trying to address is that patients feel they are not taken seriously. So, what should providers hear when a patient says that?
They should hear that the patient may not feel validated. Sometimes a provider is trying to be efficient, but the words come out too quickly. So, saying that it's probably stress or that it's normal for your age without explaining the reasoning can sound dismissive, I admit. So, a better response is, I hear that this is concerning you. Let's look at what could be going on and what signs would change our plan.
And that would be much more informative for the patient. So, another thing is that patients can be prepared, and a provider can still slow down enough to validate the concerns.
Yes, yes, that's true. And validation does not mean ordering every test or agreeing with every assumption. However, it does mean acknowledging the patient's concern before giving the medical reasoning.
Absolutely. So, that is important. A patient may not remember every medical word, but they will remember whether they felt respected. Let's talk a little bit more about the health literacy and the A plus patient. So let's define health literacy. And this way, a lot of people can hear that phrase and think it means smart or not smart. But what does health literacy actually mean?
Well, again, I mentioned earlier before the Center for Disease Control notates or defines health literacy as the ability to find, understand, and use health information so a patient can make good decisions. It is not about intelligence. A very intelligent person can still feel lost in the medical setting because the words, symptoms, forms, and instructions are unfamiliar.
Hmm. And this is encouraging because it means that people can improve upon this.
Absolutely. Health literacy can improve with simple habits like writing down your symptoms, bringing a medication list, asking for plain language, using a teach back method, and leaving with clear next steps. Ask questions if you don't understand.
Hmm. And in the materials, we review that there is a phrase, be an A plus patient. So I want to be careful because that could sound like pressure, but what does that really mean to be an A plus patient?
Well, earlier when I mentioned I wrote my article for my patients about being an A plus patient, let me just say it doesn't mean being a perfect patient. It simply means being a prepared partner. The three words I like to mention are purpose, information, and plan. Purpose means you can answer, why am I here today? When you're asked, what is your reason for the visit today? You need to be able to explain that. Information means you bring the details that help us make safe decisions for you. Plan means you leave knowing what happens next and what you are responsible for.
Hmm. And, from the patient's point of view, that is practical, actually. I mean, instead of walking in with 10 scattered concerns, well, the patient can say, hey, my main concern today is this, and my goal is this.
Yes, 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 yes. And if there are multiple concerns, which oftentimes there are, the patient should still bring a list. I love lists, but the visit may need to be prioritized with one or two issues for safety and quality. It's better to address one important issue well rather than rushing through six issues poorly.
Yeah, I agree with that. That is a big expectation shift. A patient might think, I waited for this appointment, so I need to cover everything today. But provider may be thinking, if we try to cover everything, we may miss something important.
Exactly. And again, I have to make the distinction between traditional medicine. In those visits, the visits are short and quick, and oftentimes that is the case. However, in direct primary care, your visits are a little longer. But even still, we need to prioritize what's most important to the patient to address first and what's the safety issue because sometimes that may dictate what needs to be addressed first. That is why agenda setting helps. Early in the visit, the provider can say, I see you want to discuss knee pain, blood pressure, sleep, etc. What's most important to you today? Then the provider can also identify what's medically urgent.
Mm,
Chest pain would probably be the best thing to address or suicidal ideations
mm,
as opposed to some of the other things on their list.
okay. So an A plus patient is not silent or passive. They are engaged, prepared, and willing to partner with their doctor.
Correct. Patients should ask questions. They should say when something is unclear. They should tell the truth about what they can and cannot do. That helps the provider create a realistic plan that fits their life and what they are willing to do, aren't willing to do, and are able to do. Something that's practical.
Hmm. Let us get very practical. A viewer has an appointment coming up. What should they prepare before they even walk in?
Start with the basics: your full name, date of birth, best phone number, best email, preferred pharmacy. That sounds simple, but wrong contact information and an old pharmacy can delay results, prescriptions, and a follow up.
Mm. From the patient side, I would add, do not assume the system already knows everything. Even if you have been there before, verify the basics.
I don't know. I've just been feeling kind of icky lately. Just off, I guess. Honestly, I probably wouldn't even be here, but my wife kept telling me I needed to come in.
Don't only say, I don't feel good. I feel yucky. Something's just wrong. I don't know how to verbalize it. Try to write, my main concern today is, for example, chest tightness when I climb the stairs. Or my goal is to understand why I feel dizzy in the morning. Be specific.
Yes. And the materials make a point about vague words like icky, yucky, or I just feel off. We all know what that means emotionally, but clinically, it doesn't really give enough clues for the doctor.
Right. I've had so many patients come in and use those exact phrases, believe it or not. And it's very challenging for me to be able to translate that into medical terms. Those words tell me that you are uncomfortable, but they don't tell me where, what kind of feeling, how severe, how long, or even what triggers it. So I teach patients to turn their feelings into clues.
So, let me ask a question the patients can write down before the visit. Where is it? What does it feel like? Is it sharp, dull, burning, pressure, tight? Is there cramping, throbbing, maybe tingling, or itching? How bad is the pain from 0 to 10? When did it start? How often does it happen? How long does it last? What makes it worse? What makes it better? These are all things to give clues.
Yeah, those are great questions. I actually have those kinds of questions in my tip sheet that I give to patients for how to be a A+ patient to help them be able to not only write those kinds of answers down before the visit, but to brainstorm and think on other symptoms, nausea, vomiting, diarrhea, fever, chill, sweats, shortness of breath, all that kind of stuff is important to be very detailed. Those details help us narrow down the possibilities and rule out what specifically is going on.
And what about those symptoms that just come and go?
Use a symptom journal. Even 3 to 5 days can reveal a pattern. Write the date that you began feeling symptoms, the time, what happened, the severity from 0 to 10, what you were doing before it started. Things like what you ate or drank, if relevant, and how long it lasted, what helped, what didn't help, and anything else you notice, anything that can give us a clue.
Mhm.
Just be specific and just brainstorm and think and write it down and bring that to your visit.
And I can definitely see how this makes I feel off sometimes into an actual story that the provider can actually work with.
Exactly. A timeline is powerful. It helps us know whether something is improving, worsening, recurring, or connected to a trigger.
Mm. So the handout also says that a person can use a search engine or AI as a word finder. How do you explain that safely?
Okay. So AI, Google, all this stuff, very popular. Patients need to be careful. Use it to communicate, not self diagnose. No Dr. Google here. For example, if you cannot describe a sensation, saying icky is just not appropriate, or I feel yucky. You might search for words that describe your pain quality. But don't walk in convinced that the internet has already diagnosed you.
Mhm.
Bring your questions, not a conclusion.
See, and that is a great balance. Do not use the internet to argue with the provider, but use it as a tool to describe your symptoms better.
Yes. Also bring your medications. Ideally, the bottles or a clear photo, that's super helpful, include prescriptions, over the counter medications, vitamins, and supplements. A lot of safety decisions depend on knowing the exact name, diagnosis, and how often you take your medication, supplement, or vitamin.
So, what else should people bring?
Great question. Bring your medical history, allergies, and the reaction you had, past hospitalizations, family history of major conditions, surgeries, and the year, preventative care dates when applicable, such as a mammogram, a pap smear, colonoscopy, or prostate exam.
Hmm. And for patients who get overwhelmed in the room, bring a list. It is okay to read from the list.
Absolutely. Please do so. A list is not offensive, it's actually helpful. And if you need a support person, bring them to the clinic if the clinic allows it. Just make sure the patient remains the center of the visit.
Absolutely. So, clinic journey. For some people, this can be traumatizing. So, let's walk through the appointment experience step by step. Before the provider enters the room, there can already be frustrations. So, let us start with check in. What do patients commonly experience?
Patients may or may not feel frustrated by repeating the same information on forms, waiting without updates, being surprised by copays or balances, or feeling ignored at the front desk. Those first few minutes can set the tone for the whole visit. But before we go further, let me say that is a primary distinction between traditional primary care settings and direct primary care. In direct primary care, you don't have those long waits more often than not. There are fewer patients. You have more one-on-one time with the provider. You don't traditionally see a lot of those same things that you do in a traditional medical setting.
Well, we would like to thank you all for tuning in and joining us here at Get Hooked on Wellness.